Hello, hi, I'm Stanley Chia. I'm a cardiologist practicing at Mount Elizabeth Hospital. My subspecialty is in interventional cardiology. So I have interest especially in patients who present with complex coronary artery disease, acute coronary syndromes, and myocardial infarction, or commonly known as heart attacks. A heart attack means that a blood vessel is completely blocked in the heart. When a person has a heart attack, what happens is this yellow plug suddenly rupture and the blood content come into contact with this necrotic material, and then it forms a blood clot to block up the whole artery. As you can see, this red blood vessel, if it comes down here and it gets completely blocked, then all the muscle that's being supplied by this artery downstream will be starved of oxygen and nutrients, and within minutes they become irreversibly damaged or the muscles will die. They may have what we call stuttering angina, or they may have short episodes of chest tightness or heaviness that may signal the warning of a heart attack. But in majority of patients, unfortunately, it happens suddenly. The first time they encounter symptoms is when they actually had a heart attack. And that will be a severe, tight, heavy pressure on the chest. Women very often have atypical symptoms for heart attack. They may just feel very short of breath, profuse sweating, or just feeling very tired. And when they have discomfort, they may have jaw ache, back pain, or even severe abdominal pain that they put down to severe gastric. So unfortunately, a lot of women actually put off seeing a doctor when they have a heart attack, and they often present late to a hospital. We always say that minutes means muscles. So the earlier we institute treatment, the more muscles we can save of the heart, and then the lower the risk of long-term complication. So the first thing that the doctors or nurses will do is do an electrocardiogram, ECG, to identify that this is a heart attack. Once a heart attack is identified, they will give the patient some medication to thin the blood. But at the same time, we want to have a definitive treatment to unblock the artery. During this procedure, the doctors will quickly try and put a small tube under local anesthetic from the leg or from the hand, pass this tube all the way to the heart, identify the blockage, and then we'll, if possible, use the balloon, clear the blockage, and then implant the stent, which is a metal mesh, to unblock. Essentially, it's like unblocking a clogged pipe. I'll say, don't tarry. In other words, don't wait. Immediately call for an ambulance as soon as possible. If they have aspirin, take 300 milligrams of aspirin, because aspirin is actually a low-dose blood-thinning medicine, and sometimes you can dissolve some of the blood clot and save some heart muscle. We must recognize that patients who had one heart attack, they will be at a higher risk of a further heart attack. There are several things that we can do. First of all, lifestyle measures. By lifestyle, I mean if they're overweight, try to bring their weight down to a more ideal weight. Exercise regularly, 5 times a week, at least 30 minutes each time. Make sure they have a good and healthy diet. Low in salt, low in refined carbohydrates, low in animal saturated fat. And make sure they get their blood pressure, sugar, cholesterol all checked. Doctors will probably prescribe them with several medications to take to thin their blood to protect the heart. So do be compliant with their medication. And finally, if they can, enroll in some cardiac rehabilitation program where a trainer or a physiotherapist or occupational therapist can supervise their exercise so that they can gradually regain their confidence back to good health.